And thank those of you who have joined us throughout this series. This is the 5th of the year, and we've had the opportunity to really explore in different ways the interactions between industry and health professionals, thinking about indigenizing the commercial determinants of health, and other explorations into the activities and impacts of corporation as they reflect on public health and population health. Before we really dive in, I do want to take a moment to acknowledge the traditional territories of the Mississauga of the New Credit First Nation, Anishinaabe, Wendat, Huron, and the Haudenosaunee Indigenous people on which the Dalla, Lana School of Public Health and Lawrence S. Bloomberg Faculty of Nursing now stand. We'd like to pay our respects to all our ancestors, to elders past and present. And we commit to exploring, I think, more around this. Daniel and Dr. Amy Schwanda had a previous session, and hopefully will soon launch their podcast to think about indigenizing the commercial determinants of health and incorporating these perspectives. So in the interest of time, I would like to introduce our speakers today. So Daniel, who you know is going to provide a bit of an introduction. He is currently a PhD candidate at the Dalla Lana School of Public Health, a Social Science Humanities Research Council doctoral fellow, and he is doing some really important work exploring how stakeholders view the pharmaceutical industry and its role within the opioid crisis. Following Daniel, I'm so pleased to welcome Dr. Kelly Lee, who is really a leader and a pioneer in this field. And I think we spend a lot of time often in these seminars and in this field exploring various problems. And the focus of this seminar today will be to talk about experiences and ways of engaging with policymakers on these topics, and particularly the commercial determinants of health. And Dr. Lee comes to us currently from Simon Fraser University, where she is a Canada Research Chair in Global Health Governance and the scientific co-director of the Pacific Institute on Pathogens, Pandemics, and Society. Dr. Lee's research is really focused on strengthening collective action, I think, toward public health, and a key component has been around the commercial determinants of health. And I think we're really excited to learn from you and your experiences engaging with policymakers, for better, for worse, and to have some discussions about kind of bringing these insights to action. So I know people are still joining us here, but Daniel, I think this would be a great opportunity. I will turn it over to you to kind of open the floor and to introduce us to thinking kind of around this idea of translating our knowledge to action.
Absolutely. Thank you. Thank you, Quinn. Nice to be here. Sure. So I am coming at this from a few different angles, as Quinn alluded to. Much of my work is examining policy stakeholders and speaking to policymakers themselves, analyzing how they operate within the commercial determinants of health. And then also I do work with Health Canada in their Tobacco Control Directorate as a policy analyst. I've done that part-time on a consultant basis on a contract basis for the last few years throughout my PhD. So I've been able to see it from both angles, and I can get a sense of some of the challenges that are faced by policymakers, by people working through it, and also analyzing it myself from the other end. So I'm just going to make a few observations. This is a big topic. Each of these topics that we've taken on, trying to do indigenous commercial determinants of health, like policy making, these are massive. There's a lot to work off of. So I want to really leave most of the time here for Dr. Lee to speak. So I'm just going to touch on a couple pieces that I've noted in my work and building off of that. So the first piece is this interest in quantifying the commercial determinants of health. So Dr. Lee led a paper with Dr. Freudenberg that I was involved in on what that would look like, on measuring the commercial determinants of health. And my experience in the policymaking space has been that there is a general knowledge and awareness that this is important, that this topic is important, but there's been more of a difficulty often in quantifying these pieces. So there's different avenues through which you can do this and different efforts to make it happen. But I want to highlight that a lot of us, I'm generally a qualitative researcher, that there has been recently more of a push to make that happen. And I've heard from policymakers and within Health Canada that there's a real interest in that they know what's going on. It can be different. You can sort of get the data isolated. We know these, you see the health outcomes, you see the actions by industry showing the correlations and even the causations can be more challenging. But that is an area where I think for those who have expertise in it, policymakers are looking for that data. And I know this paper that Kelly led was really, has already gotten a lot of traction. And so that would be one piece to highlight. And my partner is in climate change work. She has seen the same stuff where they know that there's often in communities, there are these connections between the actions of industries and these health outcomes. But often there's this search for good hard data that policymakers need to show and see to make their case. And so that's something we're still working through and something to build off of. Another piece I want to build off of, because I am in tobacco control and I've ended up in that work, but also ended up in working with other substances, is this idea of what's known as tobacco exceptionalism. This idea that tobacco is so much worse and has such worse health outcomes from smoking that the way we regulate it and the way we view it needs to be fundamentally different from other substances. So my experience in the Tobacco Control Directorate has been that with very few exceptions, we do not face a pressure to balance public health with commercial interests. So very rarely will you hear someone in Canadian tobacco control bring up the number of jobs that the tobacco industry might be losing or the amount of tax revenue that the industry brings in. From my experience, and this is different across countries, it's generally been decided. This is not something that we have to balance as a tension. I do know, however, speaking to other policymakers, that's a real privilege, and that is not what many policymakers in other fields are facing. Dr. Election has termed this the folie à deux. In other words, that often with the pharmaceutical industry, that Health Canada has had to essentially try to keep both groups happy, and that they end up in this place of trying to both regulate the pharmaceutical industry while having them as a stakeholder. But you can also look at the board members and the people who are involved sort of at the top of the policymaking spaces to see this represented. So, for instance, the Alcohol and Gaming Commission of Ontario, that's the provincial regulatory agency that is responsible for regulating alcohol, gaming, cannabis. If you look at their board members, only one of them has a stated background in health. The 6 other board members all have expertise in corporate affairs. One mentioned security as well. So this obviously would be unlikely to pass in the tobacco world. This would not generally be accepted to regulate the tobacco industry, quote unquote, in the public interest, as the Gaming Commission of Ontario says that they are doing, with a board that's focused on business interests of tobacco. But that is generally accepted in other fields. Especially with gambling and alcohol. We see that a lot. So what can be done about this? There are a few options, and that's where I'm going to leave it off to Dr. Lee. But one would be a cultural shift. Just this, we have this expectation that at least in Canada, that will not be the case in tobacco, and we have come to accept that is somewhat acceptable. That a business interest will be at the head of the board in other industries. But I think also as researchers, and that's where we can really segue this, we can highlight these inconsistencies. We can talk about those who are really, who have that power and the ways that we build out these boards, which end up streaming down to the way that the policy gets set. And at least as a starting point, highlighting this and looking at the way these are structured can really help us better understand why these policies end up prioritizing different areas. So with that, I'll leave it to Dr. Lee to take from there. We're very excited to have Dr. Lee speak with us, and very appreciative that she could make the time today.
Thanks so much, Daniel. And welcome to those of you who are joining. Apologies for a mix-up with a passcode. Welcome you to the finale of season 2 of Health Inc. And it's my pleasure to turn the floor over to Dr. Kelly Lee. Go ahead, if you want to.
All right, thank you so much. It's great to see so many people here, and thank you for joining us wherever you are. I want to thank Daniel and Erica for inviting me, and Quinn for welcoming me. It's great to join you on your final seminar series, which sounds like it was a real, great series to follow along, and good to see commercial determinants of health getting such attention. So I've been asked today to reflect on my interaction with the policy community, and life is so fast for all of us that it's rarely you get a chance to just pause and reflect on the things that you've done. And I see this as a very valuable thing. We need to do it more. We need to draw lessons, learn what we've done right, what we've done wrong, and move from there. So I'm very appreciative of being invited to do that. I don't often get that chance. I have a few slides. I'm going to share my screen now. Hopefully it is straightforward. Yeah. And here's the title I was thinking about, how do we engage policymakers? And thanks for that great introduction, Daniel. I think, it's more an art than a science for sure, interacting with policymakers, and that policy world is very much a very complex one. So understanding that world as a researcher is incredibly important if you really want to get your research into practice. I just wanted to start by acknowledging that I'm here at Simon Fraser University, which sits on the unceded and traditional territories of the Coast Salish people here on the West Coast. I'm sitting here in what's now called Burnaby, and I see I'm joined by a couple of colleagues from Burnaby. I wanted to just start by reminding people of this term commercial determinants of health, which is, one that's variably defined. And we have looked at this a lot and, tried to come up with a more inclusive concept of commercial determinants of health, having worked on this topic for many, many years and decades, in fact, and understanding the complexity, the depth of the activities that go on that relate to commercial actors and their strategies. So we define it. Nick Freudenberg and I have been collaborating for a few years, and we came up with this definition. It's not the definitive one necessarily, but it's the one that helps us to understand how I guess the commercial sector permeates our lives. So we define it as the ways in which actors, through market and non-market strategies and structures, and we define different types of structures, operate to generate profit, and thereby influence patterns of health, disease, injury, disability, and death within and across populations. So it's a broader term than just these unhealthy commodities, which often is the term that's used as a shorthand. It's very much what sustains the production and consumption of those products, as well as other products that have harmful health effects. And so just, why is that? It seems like a very academic concept, but why is that important to policymakers? I think there's a number of reasons why we are trying to really convey to policymakers that this is useful, and to practitioners that this is useful. And one of them is, that we can connect the dots. We can see common causes and consequences across a number of public health issue areas that policymakers must deal with. Largely, I suppose, in the health promotion area, but increasingly around also infections, around injuries, as I say, mental health, and so on. And so, it's finding those common causes, which then people can connect the policies that can address those issues. It also, the commercial determinants of health concept allows us to share evidence and policy actions across these areas. It also shifts attention away traditionally from the individuals and how individuals must change their behavior because they're practicing risky behaviors. They have these risk factors that are at individual level, to looking more at some of these societal drivers, the structural drivers, and also externally the factors that create those drivers. The companies themselves, but also the marketing companies, the legal firms, the think tanks, and so on. So just, shifting it away so much focused on, I guess, blaming the victim in some ways. Commercial determinants of health also reveals hindering factors. Why don't policies get pushed through, even though there's clear evidence that these products are very harmful, that these industries are producing harmful externalities, for example, but somehow it's so difficult to get regulation in place. And so this concept helps us understand why it can be quite a battle. And finally, really, it promotes our understanding of how these industries are enabled by broader systems that go well beyond the health sector. And that's very challenging, I think, if you are trained in public health, to understand these larger political and economic systems, but increasingly that you have to do that in order to do your job as a policymaker. So all of these reasons seem obvious to academics, and hopefully we're trying to convey that to policymakers, but this can be still a challenging task. So I'm just going to reflect a little bit about my own career over the last 30 years. And I have first to make a confession that I actually didn't start in the health sector. I actually started in a very different place and came in early in my career. So I studied telecommunications regulation, which seems a world away. But I took a particular lens to that. So I was trained in public administration, actually, and I could have actually been a policymaker at one time in terms of my career trajectory, and I was headed to work in government, but I took a kind of academic turn and started to do research as a doctoral student on political economy, and that pulled me away from government back into research and ended up as an academic. So I like to think that I had some insight into what working in government is about, and that helped me to understand what the demands on policymakers are. So I studied regulation of telecommunications and also was very interested immediately in the private sector. Don't know how much you guys know about telecommunications, but it's a private sector dominated area, and how you allocate resources, very much participation of private companies in that. And so I looked at the UN system and how that works, and how private actors can actually creep into UN decision-making processes. And so I wrote a paper back in 1997 on how that happens in forestry, in water management, and in telecommunications. And from there, I started my work in the public health field. So in the early 1990s, I shifted over to health, but I brought my lens, I guess, looking at political economy to health. And I started to write quite a bit around the globalization of the world and how that impacted public health. And, it was a very productive period for me. I was one of the, I guess, because of my training in international relations, international political economy, and public administration, I brought quite a unique lens to where I was then, which was the London School of Hygiene and Tropical Medicine, and brought, I guess, a really unusual, view of how public health was unfolding in the 1990s. I could see it so clearly, and I just really felt like I had to show people that, this is a different way of looking at what was happening. And so I published about a bunch of work, really not engaging at this point in policy making necessarily, but then something really kind of fortuitous happened, in that a number of events in the real world outside of academia started to occur around tobacco control. So for those of you who've worked in tobacco control for a while, you'll know that in the late 1990s was a really historic period when there were a number of legal cases in the United States which were settled, particularly in 1998, where you had 46 states attorneys generals settling with the tobacco companies for a very large amount of money, as you can see. But also included in that was a settlement that these companies had to put into the public domain, documents that were revealed through discovery in the legal cases, that were, really showed what was happening in the industry. And those are millions and millions of documents. It was a breakthrough that, still we're sorting through those documents and learning things about how the industry operated. It was the very first time that we really saw an insight into an industry, and particularly the tobacco industry was very revealing. And I just happened to be a young academic at that time in London and thinking, okay, what's the connection? Well, the connection is that of those documents that were released, some went to Minnesota and was set up at what's called the Minnesota Depository or Repository. And one was set up in Guildford, Surrey in England. And those are the British American tobacco documents that I'm going to talk about in a minute. And had no clue. I mean, I wasn't working in tobacco control at that time. But Douglas Betcher, who worked for WHO for a number of, for many years, decades, was in the tobacco-free initiative. He happened to be, and this is where coincidence and I guess, opportunity comes along. Doug was my student at the London School for a year, and then went on to do his PhD and then ended up at WHO. And he studied international relations as well. And that's the connection. And he started to write about the globalization of the tobacco industry. He remembered his tutor was very unusual at London School, was writing about this as well. And he got in touch and he said, did you know that these documents are 40 minutes, sitting 40 minutes away from the school? And he got my interest piqued, and he then, started me on a very long road on tobacco control. So that basically is how I fell into this area. And so what we were tasked with, the problem was that these documents were not being made very well available by BAT. They were creating all sorts of hurdles to accessing. So they would limit the hours that this archive was open. They would limit the number of people that could go in. There was no photocopying. There was a very poor database that you could search, and very deliberately so. We're also under surveillance, so there'd be cameras and recording, and you just felt like it wasn't like going into a library. If you went to the Minnesota Depository, you would have a very different experience. And so unsurprisingly, not many people were accessing these 8 million pages. And Doug got in touch and he said, it'd be great if you could go down there, have a look, see what's there. We ended up experiencing those hurdles and deciding that we really needed to liberate those documents. And that's essentially what the Guildford Archiving Project was about. A totally unacademic project in the sense that we were going down there, ordering every document they had, filling out by hand forms. So we had to fill out like 34,000 forms by hand to order these documents file by file and have them photocopied and delivered to the London School. We managed to get funding from the Wellcome Trust. You could see on those shelves, there were boxes and boxes, 8 million pages of very valuable documents. We then had to get them into the public domain, which meant sending them by ship to India, which you can imagine was very scary if a ship went down, but it didn't. So they ended up in India, where they were scanned OCR, to optical character recognition, so they could be searched, and then sent to University of California, San Francisco archives, where they now sit. So you can go to that website and see those documents. And that was a 10-year project. It was just something we did on the side of our desk, but brought us really closely into the policy domain, and also, other areas, the legal community as well. But that happened, just out of an opportunity, but also we saw the importance of that, not only for research, but for policy. And so there's the archive itself. It sits, as I say, do go on it if you haven't already. This website is incredible, the UCSF website. It's now called what's it called now? The Truth Tobacco Documents, I think they're called. It was called Legacy at one time. They also have food documents, pharmaceutical industry, I think opioids. I think, Daniel, you've been working on the opioids documents. It's an incredible inside look at how these companies operate. But the tobacco documents were the earliest, and they therefore were the most candid. You can imagine if documents come out now, they'll be carefully curated to get into the courts. So that's what we did on our side of our desk. In the meantime, we're researchers. We're not, we're not spies, and we're not policymakers or legal lawyers. We were academics. So what we wanted to do was make use of these documents, and they were trickling out of the Guildford archive. So we knew that they were valuable, what we were seeing coming out. And so we applied for a number of NIH grants, which we were successful at receiving, partly because we had access to these documents. I think, having unique access was incredibly advantageous to funding, but also we put them into the public domain right away. And so, we weren't sitting on them, but we were starting to get expertise at analyzing these documents. And I think that was a unique expertise. No, these documents never appeared before. How do you analyze internal company documents? It's something very new to public health. And so we had a kind of niche in many ways. So we initiated these activities, largely focused on British American tobacco, but we also looked at other companies as well. And I know Jennifer Fang's online. She was part of our team that was the latter part, the third grant, where we looked at all sorts of company activities in around the world. But we produced hundreds of papers from this. It was an incredibly productive period. We learned a lot about how companies work, revealed a lot about how they operate. And I'll just talk a little bit about how this was well before the commercial determinants of health was a concept even, but we learned a lot that then fed into understanding what that concept means. So we looked at market strategies, a very obvious one, how companies operated in different markets, how they got into markets, how they used all sorts of advertising to get around local regulation. And more recently, this is actually not under review, it was already published in 2020, that, we looked at new generation products and how they're always looking ahead. They're always seem many steps ahead of researchers and to some extent policymakers. You're always trying to catch up with what these companies are doing with their strategies. Looked at a ton of range of things. You go in there and the documents really drive the research. So it's a very iterative process, but marketing of smokeless tobacco to young hockey players was one project that we did, or that I did. And you can talk about many more. We looked more I guess, more innovatively at non-market strategies, and that was very important. Looking at how these companies pursued their goals by exerting power and influence over government, over regulatory, processes, setting the public agenda really, and undermining public health agendas. And that's very revealing because it showed how far-reaching the networks of tobacco companies are. It's not just the companies themselves and their corporate affairs section of their companies, but it goes into working with think tanks. We found a network of think tanks that receive tobacco money and other corporate money, and how they're not independent. And it's really important that you recognize that think tanks are not independent, even though we take their research as such oftentimes. How the companies themselves frame certain issues so that it becomes a non-issue, or it becomes a less important issue than other issues. I looked at how the tobacco companies funded academics, and these academics then became, very respected. They put out work that subtly undermined tobacco control in ways that, we didn't realize. We just thought it was research, good research, and so our own community within, among academics was also permeated by industry money. So I won't go into all of these, but I want to go back to this network of the ATNIS network, because this won't be necessarily visible to policymakers when they're trying to put a policy out, and then think tanks come out and, kind of do these policy reports, or, seemingly weighing up different policies and then coming up against the policies you're trying to put forward to protect public health. But when you reveal that a lot of these think tanks receive money from tobacco companies, it's really quite telling. And then you can use that to say, well, that comes from the tobacco companies. No wonder they're saying things like that. So the Fraser Institute is one of the more famous ones in BC and across Canada. It is considered one of the largest think tanks in the world. I'm still getting emails from them, inviting people to submit their top students to go undergo training with the Fraser Institute. I always delete those, put it into my junk folder, because I don't think that that's appropriate, because you can never see on their website where they get their funding from. They're clearly not independent, and it's really important that that's understood. So these are the kind of reports that think tanks put out. They and this is related to vaping and tobacco control in particular, but you can see it in every policy area. I think we need to be more critical and aware of those, the positioning of those so-called research that comes out of these organizations. We have tried to reveal more around, where all this industry money goes, and this is not just tobacco, of course. This is throughout many different areas where we're concerned about corporate influence of public health policy around cannabis, for example. The cannabis industry has funded a chair at UBC. There are obviously lobbying that goes on, and we have registers of lobbyists. Those are variable in how revealing they are and how detailed they are, but they're very important. I think the main thing is that we need to really create firewalls between the vested interests of corporations and private companies and the public interests, which is what policymakers are trying to represent. It may include private interests. I mean, private interests are part of society, but it shouldn't be driven by. And so we recognize that, by doing our research, we can at least reveal where the firewall is being breached. And that's, it gives policymakers at least a heads up. Where I think we've been particularly influential in our research and really informing policy is around illicit trade of tobacco. And we, when we dived in the early 2000s and finally got access to these documents, we were surprised as any at how much they revealed in terms of the illicit activity. And this is a story that I don't have time to tell, but the map on the bottom right here is direct from a Brown and Williamson document, which just describes, and transit is a kind of euphemism for smuggled cigarettes, but they even drew out where the kind of routes that were used for these transiting of cigarettes that are trying to get around taxation and getting into new markets like China. So, we wrote papers on this. We then, these papers are very influential in the Framework Convention negotiations, which this is where I think, found that bridge between research and policy was becoming stronger. They were starting to look at our research and see it as incredibly useful for informing international negotiations. And so that was exciting. I even got to sit up in the gallery and watch and see, the negotiations take place. And you can see some of the research starting to be cited. And, we saw this paper and, it showed this, and this is why we need to have this convention. So it was so satisfying to see that. And, you can't get a better kind of reward for some of the work that you do. And it's very painstaking work. It takes a long time to write these papers, but we managed to shoot out quite a few of them around the smuggling of tobacco around the world. And it's a story that, even now it continues in different parts of the world that we continue to keep an eye on. And but we managed to get it out into the peer-reviewed world. And the most recent is in Paraguay, where colleagues and I wrote about the role of Paraguay in South America and how it transits or smuggles tobacco products across not only in the region, but further afield. And the big story was that the company that did that is run by a former president of Paraguay, which, made us think twice, like, do we want to do this? Do we want to write these papers? But the story was so clear that we did write these papers, but then we thought, well, it's not us that then, disseminates this work. We need to get this in the public domain through the local media, which is what we did. And so luckily ABC Color picked it up, a journalist we spoke to, picked it up. It was a big story in that country. I know it's a small country, but this was a huge story. They suspected this, but they needed the evidence for that. So we worked with the media, and the policy influence really came from that. So Horacio Cartes, who's the former president, people really started to pay attention with this evidence, and we were told that our papers made a huge difference because it was outside the country. Perhaps, we didn't have any vested interest to take this guy down. We were just doing research. It was peer-reviewed research. It went through legal review. That's the other thing I should mention. When you're a researcher, you don't often have to go through legal review, but when we were writing these papers, and the things we were saying, it was very important that the journals wanted us to go under legal review. So they checked every document that we cited and that we cited them appropriately. We didn't overstep. We didn't push our claims beyond what the document said. So we learned how to write papers in a way that said, the document said this suggests that. We were very careful in our wording, and that was legally approved. Anyway, the US government took notice, and so on. So just to say that he's in a bit of hot water, and we managed to, kind of facilitate that through our research, and we are still researchers. But importantly, I think what you were saying, Daniel, about, what are those answers to the kind of things that we're revealing? It's one thing you document all these things, but what can public health practitioners and policymakers do? So we thought we'd do a review of what are the different ways that policymakers and regulators and practitioners have responded to the commercial determinants of health over the years. What works, what didn't work. And we wrote this paper as hopefully a useful summary of the different strategies. It's not going to be one strategy. It's going to be lots of different things. And we laid those out in this paper last year. And it's a really multi-pronged approach that gives you a kind of menu that you can draw from that enables people to think about, because commercial determinants of health are complex, you need to have a complex response as well. So we wrote that paper, and from all of this work, this is probably all a bit of a stream of consciousness presentation, but from all of this work on tobacco, on, kind of conceptualizing, and I didn't mention the measurement paper, but that was incredibly, I think, useful for WHO is now trying to write a global report on the commercial determinants of health. This brought us to the attention, or including myself, to this new program. We've been pushing for years, and it's been taken up and supported by the Director General, which is excellent. It means that, we're kind of almost arrived. We finally, we're actually a topic, and that it's a valid area of health research. And I think that's incredibly important. And so a lot of us have been contributing, who have been doing the research, been contributing to expert meetings. And also some of us have been asked to be on the editorial board of this global report, which is, I think, groundbreaking in its efforts. It will get pushed back. We are completely aware that the industry is very monitoring this report. Will be mustering many of the strategies that we know will happen, that they're very good at, to undermine this report. But it's important that we progress, and this is a really coming together of the research and policy community at the global level. But I should say, as I've been doing this research over my career, it has been hard sometimes to and especially more recently, is to get funding for it. And I just give you some of the peer reviewers, as you get closer to supporting policy and writing for policymakers and really pulling out the evidence, which I think some peer reviewers find quite journalistic. I guess they see it as, this isn't research, this is more like advocacy. And we've had this, despite, as you saw, publication of this research in top peer-reviewed journals, the Lancet, the BMJ, Tobacco Control, American Journal of Public Health. I mean, these are not newspapers. These are public health journals. We've gone through strict peer review, legal review, and they finally come out. So it takes a long time to produce one of these papers. So it's frustrating when you give all this and put this into a proposal to say, hey, we want to study the Canadian tobacco industry. We know a lot about the global tobacco industry. I'd really like to apply my knowledge to how the industry works in Canada. And we got comments like this. We did not get funded as a result. And this was pre-pandemic, but Jennifer and Julia and all of us felt very, very frustrated because we felt so passionate about this work. We are not advocates. And I think that's one of the lessons, is that we have to really maintain that researcher persona. Even though we're very much supportive of certain policy measures, we don't cross that line because of this kind of reaction, that we have to be seen as independent, scientific, whatever that means, evidence driven. And we've maintained that throughout. And so, it has been frustrating. So yeah, that's kind of why our tobacco control research kind of petered out just before the pandemic. We were finding it very hard in Canada to get traction with peer reviewers in CIHR and to renew our NIH grant. And now we're in a different place. So, I've worked on the commercial determinants of health in other areas now, and infectious disease is one of them. And what's, I think, new since the pandemic has been real counterattacks, I guess, this kind of questioning of researchers is somehow not in the public interest, that we are all now interest groups. And I think that framing of academics who have really provided an incredible amount of evidence to policymakers over the years, to cast or frame academics as somehow a vested interest itself, is very, very clever, but it's also very concerning, because it means that our voice becomes this equivalent to a private sector actor, when in fact it is very different. So I've been described as a WHO employee, never have been, I have to say, but that the truth never helps, never hinders some of these individuals who accuse people of things. And you have to kind of continue with your work, and it's your integrity is questioned, but you still have to continue to publish in these peer-reviewed journals even more than ever to show your value. So I'm very, very pleased that that the work that we're doing on the commercial determinants of health is now becoming more known and permeating down into other levels of government. So had a great meeting, a couple of meetings with the BC government. Very excited to support their work. And so we're looking forward in the future to doing that. Daniel's involved in that, as well as Julia and Jennifer. So, casting an eye over this framework for public health would be a starting point. And I think, Gerald, you might be on the line here. Please jump in and correct me if I'm wrong, but I think there's a lot that can be added to kind of just help a lot of these goals to being achieved by putting that lens on. So delighted that we have that opportunity to at least try and help do that. And there's unlimited areas where we could go, and it's far beyond tobacco into a ton of areas, because there's going to be continual pushback. And I think that the commercial determinants of health allow us to push back on the pushback in some ways. So in the end, just coming to the end here, and I know we only have limited time, I'm so pleased that, the commercial determinants of health as a concept is kind of, it's now got a critical mass of people researching this, but also governments taking notice. So its time has come in some ways. And I'm really pleased to see, this book come out. There's papers coming out every week on different aspects of these strategies. Many more names out there than the usual suspects that we were, there were only a few of us working on this at one time. I love seeing people like Daniel doing his PhD on this, many others. It's an incredibly interesting area of work, but it's so also, so incredibly practical and applied. And I think that's why I really gravitated towards this, and why maybe, I can fulfill my public administration early aspirations through this work. So that's great. I'll just say finally to sum up, I think I was lucky in many ways in my career, and that my background was ideal for studying these kind of issues, and opportunity came along and I recognized it. I think that's really important when, policymakers at whatever level come knocking. It's really important that you engage and you're open and that you understand what their needs are. And I tried to do that, and where you can help. It doesn't mean, you become an ally, but you don't become the same. And I think keeping that distance enables you to be more effective. So keep doing that peer-reviewed research, keep informing these kinds of really key areas, help the policymakers think through and give them heads up, of these issues, where they're maybe not seeing things, you're seeing them in research. So be a good ally. I would say that you do need to actively engage as a researcher in knowledge mobilization. We do that anyway, but I think there's a particular appetite for this kind of research. And so media is always there reporting our work, but also creating these outputs that, would be useful for policymakers, important. And yeah, I've just already said that, a lot of the research gives that the policy community an awareness. They experience this every day, and they may not understand why these things happen, but giving that evidence, and then providing some options for regulatory approaches is how I see my work, giving them the best tools that they can take forward, and in a way, and enable them to do the important work that they do. So that's it for me. I think it's been nearing the end of my career in many ways, but it's kind of the most satisfying area that I've worked in, because it does impact so many different people. And I hope I can continue to contribute to this going forward at whatever level, global to local. I'm very open to that. Okay, I'll stop there, and I'd love to hear questions, comments. Thank you.
Thank you so much, Dr. Lee. If you would all join me in thanking her for this presentation, which was such a perfect, I think, reflection and wrap up for a season where we have really explored various facets of industry's activities, their population and public health impacts, and people who are actively doing research in this space. So I invite you, we have a Q&A box. I see one question has come in. I'll maybe reflect back some of what I've heard while people submit their questions. But I think, Dr. Lee, you so well discussed the role of someone working in the field of commercial determinants of health, or corporate determinants on health, in the sense of generating evidence of industry activities. And it's so exciting to hear really the development of new methods and data sources, such as the industry documents. I think another initiative that strikes me is research that brings transparency to stakeholder ties with industry, and really making visible all the actors and their interrelationships, which are so often behind the scenes. And then I think the importance of really finding levers to create independent expertise. And as you say, we are part of society. All these stakeholders perhaps have legitimate interests, but that we can serve our role most effectively, perhaps as researchers within these policy processes, through generating kind of an independent evidence and those messages. I have one question in the Q&A box here from Roland, and Roland, please, if I don't interpret this, respond again. But Roland is asking about the skill set researchers might have to actually deal with individual commercial establishments or entities or trade organizations. And I think part of that question is, are you interfacing directly with industry actors? Is there a skill set there, or is it more that policymakers are kind of the go-between?
That's a terrific question. And we struggled with this for a long time. None of us were business graduates, but that I think would have been an ideal background in many ways. How do these companies work? How do you create a marketing strategy, a business plan, investment, and so on. So all of these things we learned as we went along, as we went in, tax policy. They're very specialized areas. The best researcher, one of the best researchers I recruited, happened to work previously with the alcohol industry. And so they had an inside insight. They we turned them basically, and they became on the light side. But he is brilliant at, because he can speak from experience at how these companies work from the inside. The typical, epidemiologist or a public health trained person would probably need to learn new skill sets for sure. And you wouldn't be able to learn all of these things. So when we were building our team, we tried to get consultants who had tax expertise, for example, because those are incredibly technical. And how do you negotiate trade agreements that have these very specific tax clauses? You have to be willing to, I guess, tap into very specialist expertise. It'd be great if you learned, took even a basic textbook on from some business school to understand about companies and how they operate, how you set up a company, the different types of companies and so on. And go from there. We managed to do it, but it's a very different skill set from public health. And I think that's part of the challenge. I think that's part of the, these documents, they seem very, very a different language, and, being able to decipher them forensically is incredibly important. So yeah, I think we need to have a very multidisciplinary team when you're working on commercial determinants of health.
Thanks for that, Dr. Lee. I see in the chat we have Gerald Thomas from Public Health BC. So
hi, Gerald.
We have a diverse audience here today, and it's fantastic. So many could join. I have another question here in the box from Natalie Brender. Natalie asks, what does your research experience suggest about kind of important proactive steps for researchers or public health practitioners to take when we have these new health impacting industries emerging? So Natalie mentioned psychedelics. I know in your talk, Kelly, you talked about the cannabis industry chair. So recently legalized emerging industries and ones that are taking kind of a corporate track. So any thoughts on that?
Sure. And I know Natalie got in touch, so we're going to speak I think next week, Natalie. But you're absolutely right. There's always going to be things coming on stream, and the private sector does what it's designed to do. It's to create, it's to generate wealth, right? And the opportunities are diverse. Some of them will be health promoting, some will be health harming. And so they have, they're almost amoral in some ways, right? Or they're not doing it to harm health, but you have to be aware of that. And I think just looking back at the lessons from how we handled cannabis and the legalization, how we rolled that out, how we rolled out vaping or, alternative nicotine products. What did we do right? What did we do wrong? Protecting those who are, less able to make informed choices. Those sorts of things, getting those products to where they're needed. There's some good in those products, but also preventing harm. So you can, we have so many industries that will come on stream and will be, in future. So learning those lessons, this is why the commercial determinants of health concept is useful, because, there are generic lessons to learn, and they're probably regulatory lessons that can be moved from one product area to another. And I think we haven't done that so much in the past. I think that this allows us to do that. But yeah, psychedelics is certainly on the horizon.
So Kelly, we have 2 minutes left and 2 questions. And so maybe I'm
so sorry.
Them both and see if you can maybe wrap up these answers. So Shruti is, picking up on some discourses around, with the well-being economy, sustainable economy, circular economies. How do we approach some of these discourses around kind of the corporate responsibility or partnerships and this working together, or the industry's ability to advance public health goals? And Raymond makes a great point about kind of issues around the revolving door, where we have people from industry coming to work for the regulator or leaving the regulator to work for the industry they formally regulated. And then I think in closing, Lorraine, actually one more question popped in here. How do we study the commercial determinants of health that promote in a way that promotes and sustains public trust, rather than kind of laying bare all these entanglements and undermining kind of faith in some of these regulators? So those are 3 massive questions, but you can see sparked a lot of thought, and thank you. We hope to continue these conversations.
Yeah, these are all great
Maybe as
questions.
a
I'm so
final
sorry.
word.
I think I've run over time a little bit. This kind of revolving door between government and industry is a longstanding problem, and regulation is very important. I think conflicts of interest, regulation, and we know that. So that happens a lot, and it's not regulated enough, and certainly we need to do that. The question Shruti put is really it's really important to recognize that we're not anti-private sector and anti-market. I think that societies, we can make our own judgments, but markets are a part of society, and there's good and bad that can come from it. It's how well we regulate it to protect the public interest. So there's ways of organizing economies that are pro-health, and I think rather than, we're not saying get rid of markets, and certainly not get rid of companies. And so you have to be careful about what companies claim. Some of them are doing good things, and some are doing things that are not so good, but claim to be doing good things. So being able to recognize that is important. So not completely cynical on those things. And then the last question was around, remind me, Natalie, Quinn?
So Lorraine is asking about how do we do this in a way that sustains and maintains public trust, rather than perhaps undermining kind of perceptions of, big industry and its ways.
Yeah, it's a big problem. I think big government, big industry, everybody's, there's a lot of distrust out there. I would say that, societies are what we are about values and what we want, for example, Canadian society to be in those roles that government, state, and civil society plays. And I think being revealing doesn't mean that you dismiss those sectors. We need them all, but I think that we're helping to make it more transparent, and that way also seeing what's good about these different sectors as well is important. So yeah, big philosophical questions. I'm sorry I can't answer it in a more deeper way.
No, thank you so much. I know it is a very busy time of year. We are coming up to a long weekend, and so I know people have probably other places to be and things to do. But if you would join me again in thanking Daniel and Dr. Lee, my co-host Erica DeRuggiero and Vadim Levin, who supported this event. Thank you all for joining us here at the finale of season 2 of Health Inc. We look forward to hearing from you. If you've got ideas about future seasons, episodes, get in touch. We'll be putting our heads together to see what the future for this series might look like. So thank you again for being here. Have a wonderful long weekend, and take care, everyone.
Thank you.